patients across India and across the world are suffering from end-stage liver disease or liver cirrhosis. Many of them actually can only be cured by a liver transplant. Unfortunately, many patients die without the option of liver transplant ever being discussed with them. We can only move forward when doctors start referring patients with end-stage liver disease for the only hope of cure, that is liver transplant. Here at Artemis Hospital, we are among the few centers who perform liver transplant regularly. So how does the process work? So you get to know that you have end-stage liver disease or you have cirrhosis, and the doctor says, yes, unfortunately, the only cure is a liver transplant. Once that happens, you need to start doing your homework. You need to go on the internet. You need to start getting information about a liver transplant. Liver transplant can happen in two ways. Either you get your liver from someone who has died or is brain dead. That is called a cadaveric liver transplant, or a deceased donor where the donor has died. Or you get it from a living person who is a relative. That is a living donor liver transplant. So what happens? Your relative, maybe your son or your daughter or your father or your brother, whoever is between 18 to 45 or 50 years of age, who is fit and is of a matching blood group and has no major health problem. So the person comes and we do a series of tests to find out whether he or she can donate the liver to you. So how a person has only one liver, so how can he or she donate the liver? This is because we only take 1/2 of the liver. And the beauty of the liver is that it grows back very rapidly, like your nails or your hair, and it grows back to 80% of the size within a few weeks and to almost 95% of the size within a few months. The liver grows back very fast. That is why you can donate a part of your liver. So if a donor comes in, we do a series of blood tests, we do a CT scan, we do an MR, we do a echo to see whether the heart is okay, we check the lungs, and if every single test is fine, and if the size of your liver, the right lobe and the left lobe is fine, then you can donate your liver. Once the medical evaluation is complete, then we have to take a permission from the Government Authorization Committee. The authorization will check that the relation is correct, and once they are satisfied that you are donating it out of your own free will and not under any pressure, then the government gives the permission for us to go ahead with the transplant. In a series of 2 parallel operations, we operate on the donor for about 8 to 10 hours and on the patient, whom we call the recipient, for around 12 hours roughly. And in that operation, we take out the entire diseased liver from the patient and send it for examination, and we give half of the liver from the donor to the patient. Usually in 80% situations, we would have the patient admitted with us for 21 days and the donor admitted with us for 10 days. After discharge, the donor needs to stay with us in Gurgaon for another 4-5 days, whereas the patient needs to stay with us for another 3 to 4 weeks. Overall, liver transplant has a 90% success rate, which means 9 out of 10 patients will go back home well. Out of these 90%, 80% would usually be a smooth recovery, 10% would have some complications which would usually be manageable. At Artemis Hospital, we have a robust liver transplant program, and we have specialists not just in surgery but in the intensive care, hepatologists. We have a very good team of anesthetists, and so far we have been successful in being able to send our patients home.